Hi, I'm here with Dr. Kevin Huff, oral facial pain specialist and general dentist located in Dover, Ohio. And we're talking about the different aspects of oral facial pain. And one of them is emotional. Dr. Huff, can you please shed some light on this aspect?
Yes, absolutely. The model, first of all, it's important to understand that when we look at treating orofacial pain, the current and the most evidence-based approach to managing orofacial pain is to use what we call the biopsychosocial model. And that means that we look at the biology, the problems that we've already talked about, where you've got physical things to work with, that we can feel, that we can touch, that we can listen to and hear about. Um, However, a large component of orofacial pain is what we call the psychosocial component. In other words, the psychology of the patient and the social aspects of that patient's life. In other words, how does this patient experience pain, and what kinds of things in that patient's life might be causing pain to get worse or amplifying pain? So that's not to say that patients are crazy, or it's not to say that it's all in their head. I hear that a lot. And obviously orofacial pain is all in their head, but it's actually a real problem. So um, but when we talk about that, that's always a tough thing that people aren't ready to talk about, is that, patients, especially, we've just gone through, or we're in the middle of a pandemic and starting to come through that. But allostatic load is what we call that, where this basically life's crap that is piled on our heads. Okay, so we all have elevated allostatic load. In other words, the psychosocial load in our life is very difficult right now. So we do see increased pain syndromes related to that, or what maybe people can tolerate and our bodies normally handle minor aches and pains because of the psychological aspects that we're going through right now. That's a It's a huge factor that makes things worse. It's kind of like the straw that broke the camel's back. um, Other things that cause increased issues: menopause for women, for instance, that increases the allostatic load. More emotional factors involved there and things like that. Um, Divorce, loss of a job, loss of income right now with unemployment. These are all factors that play into making pain worse. So we, even though this is the last aspect, or that we often include in orofacial pain, it's definitely not the least important. In fact, it's probably the most important aspect, and how we manage that and the questions that we ask are very important. And a key component of my practice is working with the primary care provider, the patient's family doctor or nurse practitioner. Sometimes we work with counselors, and sometimes we even make some referrals for psychiatry, only to help manage this biopsych or this psychosocial component of pain.
I could see where you probably wouldn't if you had so many things going on in your life and it just gets stacked on and stacked on. You don't even realize what is that's doing. It shows up as pain,
That's right.
or comes out as pain, right? And you're probably adding up all these different factors. Yeah.
And one of the important ways that people deal with stress is that we interact with people. We interact with our families. We hug people. Well, when we're not able to do that, or when we have to wear masks all the time, we don't get to interact the way that we normally would interact. I mean, it's well known that there's a chemical called oxytocin that our body releases when we hug one another or when we shake hands. And those are that we're not getting that. That's one of the kind of the things that's like an endorphin for us and makes us feel better. And I mean, oxytocin is what causes bonding to occur between an infant and a mother. So, when we're when we're restricted from that in any way, whether it be a pandemic or whether it be separation because of divorce or depression, anxiety, things like that, this has a lot to do with our ability to cope with pain.